there's still like a week to go until I'm completely free. But you know, I don't think I can stream next week because I'll be busy with either studying or like packing and unpacking. So I'll make sure I'll um make an announcement to announce that I will be moving soon, like returning to my old home anyway. Yeah, I need Moobot. Yes. What kind of music can I play? I'll just play the Inazuma like main theme. Fuck it. Like, you know, I like I like it. Okay. Go away, go away, okay. Yes, the Inazuman music. Very good, very nice. Head trauma. Okay. Let me change the text first. Uh Property. Head trauma. Okay. There we go. There we fucking go. Okay. Pathophysiology of TBI. Trauma management. Okay. Pathophysiology, blah blah blah. Surgical treatment, skull fracture, intracranial lesion, focal. DAI concussion. Classification closed. Penetrating. Okay. Gunshot wound, high velocity, low velocity. Severity, morphology, skull fractures, and intracranial lesions. Basilar, focal, diffuse concussion, diffuse axonal injury. Yeah, I guess so. Wait, how many do I still have left? Oh, nothing much. Glasgow Coma Scale. Assessing the severity. Alert, verbal. Okay, GCS. Pupillary reflex. Glasgow Coma Scale. Let me enlarge it and take a look. Best motor response. Okay. Eye opening. Okay. Assessing the morphology. Okay. Volt. Linear depressed. Skull base. DSF leak. Okay. Uh. onwards. Unable to stream. Moving back to my old home. As I will be busy with packing and unpacking. No stream. Okay. Thank you for your patience. Yes. Okay, there we go. I made the announcement, so hopefully my babes will, you know, they will read it. But I will be conducting my own studies. Assessing the morphology. Okay. Intracranial lesions, extradural hemorrhage, subdural hemorrhage, contusion, contracule injury, diffuse. Depressed skull fracture. Okay. Depressed skull fracture. Okay. Thickness of skull. Focal deficit. Okay. Pediatric ping pong ball fracture. Growing fracture. Skull base fracture. Battle sign. Raccoon's eye. Scissophilic. Hemotympanium. 7. Nerve 7 palsy. 6 palsy. Epidural. Hematoma. Loss of consciousness, lucid intervals, hemiparesis, dilated pupils. Rare before 2 and after 60s. Okay, subdural hematoma. Parenchymal laceration. Torn bridging vein, okay. Contusion. I've known like a lot of them, so. Traumatic intracerebral hemorrhage. Intracerebral hemorrhage, okay. Ditch, okay. Talk and die. Diffuse axonal. Wait. What in the flying fuck was that? Oh, I hate studying. Intracerebral, okay. Diffuse axonal injury, okay. What the fuck does that mean? Post-concussion syndrome, okay. Confusion, amnesia, dizziness, headache, nausea, disorientation, memory deficit, neuropsychiatric symptoms, cognitive impairment, okay. I mean, these contact sports are quite dangerous, so. Standardized assessment of concussion, orientation, immediate memory. Okay. Concentration. 382. Reverse digits, okay. Go to next string, string length if correct on the first trial. Stop if incorrect on both trials. Okay. 382. I would fail about, like, with the concentration thing. 697,351, but 153796 or something. That's hard. Month of the year in reverse order, okay? December, November, October, September, August, July, June, May, April, March, February, January. Oh. Constitution score 5, okay. Delayed recall, approximately 5 minutes after. Okay. Summary of total scores. Between immediate and memory, blah blah blah. Scat 5. Oh. Oh. Well, let me pull this up. Like that. Okay. That's better. Secondary brain injury. Okay. Hypoxia, hypotension, hypercapnia, iatrogenic hypocapnia. Cerebral perfusion pressure, mean arterial pressure, intracranial pressure. Okay, these volumes are housed within a rigid, completed, closed skull vault. Okay. Morrow-Kelly doctrine. Mean arterial pressure because one... Okay. systolic minus diastolic 1/3 plus diastolic. Cerebral blood flow. Mean blood pressure. So mine is like 120 minus 70, so it's 50. 20, 80. Okay, 80. Serial perfusion pressure. Auto regulation. Okay. Auto regulation. Cerebral blood flow. ICP waveform. Percussion wave, tidal wave, and dichrotic wave. Dichrotic notch. No idea what that is. Pathological waveform. Epidemiology 1. Approximately 40% of all deaths from acute injuries in the... Wait, let me go get something. Alright, I'm back. Do. Epidemiology 1. Approximately 40% of all deaths from acute injuries in the... I don't need to know about, you know, the US stats, okay? Like one... Okay, 0.1%. 0.015. Okay, pre-hospital deaths increased that figure to 1 cases, okay? Young people, low-income individuals, unmarried individuals. But is it because they, you know, fight a lot? Members of ethnic minority groups, residents of inner cities, men, ooh, individuals with previous history of substance abuse, previous TBI. High-risk people, young people. Okay. Principles of trauma management. Trauma resuscitation. Advanced trauma life support. Okay. Team leader, same guidelines, sing from the same hind sheet. Okay. C-spine protection. Airway, surgical airway. Breathing, ventilation, and oxygenation. Circulation and hemorrhage control. Okay. Hemorrhage control, assess pulse, BP perfusion. 40 to 60 G peripheral IV lines in forearm and antecubital fossa. So it's like here. Something. Take blood for mismatch in glucose. No saline infusions. Lord. Is that the music from what's that called? Watatsumi Island? Thoughts of lightning. Okay. No, I don't want to log into Adobe. Dysfunction of CNS. AVPU, Glasgow scale, of course. Exposure. Remove all clothing. Remove from background by performing log roll. Examine entire spine. Resuscitation. Look for life-threatening hemorrhage. If bleeding present, stop the bleeding. External bleeding. Rapid suture or skin stapling. Fast scan positive, go to theater. Anterior binder. Focus abdominal sonography for trauma. Okay. Ample story history. Examine everything. Fingers and tubes in every orifice. Chest X-ray, pelvis X-ray. Emergency physicians, emergency nurses, radiographers, surgeons, plastic surgeon, cardiothoracic surgeons. Okay. Neurosurgical trauma management. Okay. CT head rule. Serial clinical exam. Okay. CT not AV signs of head injury. Skull base fractures, CSF leak. Okay. CT. Serial clinical exam. Progress CT. Admit if GCS remain less than 15. Okay. Primary survey resuscitation. Okay. That's the GCS score, okay. Repeat seat, serial exam progress CT. Repeat CT when deterioration. When deteriorate, okay. When deteriorate, okay. Charged with follow-up. Primary surgery, okay, A, B, C, D, E. It's the same. CT blood. Serial exam, ICP, Eco 2, CT definite NS care. Prevent secondary insult. Shut up, YouTube, I don't care. Oh my lordy. What's this? ATLS guidelines. Goals to prevent secondary insult. Stabilization, resuscitation, okay. Prevent hypoxia, hypotension, and hyperglycemia. ICP monitoring. GCS less than 8, of course, it's like severe. Intubation. Positive CT brain, okay. Negative CT brain larger than 40, BP less than 90, disturbed posture. Management of high ICP. Prop up, sedation. Drainage, hyperventilation. Controlled hyperventilation. Barbiturate coma. Coma, okay. Moderate CT scanners have revolutionized imaging for head trauma. Adult X-ray obsolete, of course. Why? Don't they have like CTs already? MRI not practical for acute injuries, of course. It takes like 20 minutes. Surgical treatment, craniotomy. Plot evacuation. Open depressed skull fracture, okay? 2 meters of welding. Amnesia landed off left side with head injury, wrist injury, and chest wall injury. Jesus full, walk-unaided, okay. Orith by, okay, craniotomy, craniectomy. Fell from highway, head injury, facial injury, spinal injury, and ankle injury, excessive leak. Jesus. It's like a break, okay. Craniotomy clot. Evacuation, EVD insertion. Whoa. Anophthalmos and diplopia. Correction with Medport implant. 6 palsy and diplopia ambulatory. 5-year post-injury flashback. Pathological gambling, memory deficit, impulsive symptoms. Epidural hematoma. 27 dizziness and fell. Hit on Turian. Lucid interval, temporal bone fracture. I don't see the fracture, but oh well. At least I can see the like dural hematoma. Torn MMA, okay. 15 walk unaided, 5 left-sided hearing loss. Oh, that's sad. Gradually recovered in 1 month. Head injury when playing football, sorry. Loss of consciousness, headache, and vomiting. No seizure, no injuries. Initial 15, GCS. Power 4. High parietal acute epidural hematoma with left parietal bone fracture. Okay. Whoa. Mach 24. What? Mild headache. Delayed presentation. Assault injury with right head forehead laceration. Okay. Frontal bone fractures. Initial scan. Deteriorate next morning. Whoa, what the fuck is this? No more agitation. 30. Bothell index 94. Subdural hematoma. What is this? Okay, trauma call. Jump from bridge, what? Labability higher dose inotrope. Very tight, okay. Herniating out. Ugh. Grave prognosis. So, post-op ICU care. No brainstem reflex. Brainstem death test and certified in ICU. Oh, it's got what he wanted. Gradual deterioration. Retrograde amnesia. E1 V2 M5. What? Okay. Multifocal contusions over right frontal. Whoa, it's heavily bleeding. Sylvian clot. Okay. Enlargement of Sylvian clot. Okay. Salvageable. Comfort care. Uh-oh. Contusion. Head injury during football game. Never play football, Lee. Jesus. Cause of hyponatremia. No idea, you tell me, doctor. Diffuse axonal injury. Motor vehicle accident with head injury and facial laceration. Jesus. No witness seizure. Jesus 9 on admission, intubated, of course. Right. 3, 4. Spontaneous movement positive. Okay. CT brain. Is that the eye coming out? I don't know. You can't even differentiate the gray and white matter anymore. Cistern present. Can't even see the spatial cisterns. Cerebral edema. Tight brain. Loss of sulci and gyri. Compression of basal cistern. Jesus 14. EV off on day 5. Wound well, diet tolerated, no vomiting. Repeated CTB. Sitting training. Okay. Individual cognitive rehab. Okay. Visibility allowance care plan. Head injuries are initially treated by looking after the whole patient systematically. Don't forget the spine. Neurophysiology. Need to act fast before it's too late. Live or die depending on our pace. Same guideline in trauma resuscitation. Okay, surgical treatment of this one. More surgery, there's lots of surgeries. Literature review. Case scenario. Wait, where's the charge? I need the cable to charge my phone. Charge my phone for now. Literature review. Aneurysm, clipping endovascular, embolization. ICH, excision, stereostatic radiosurgery. Craniotomy, clot evaluation, large infarct. Coiling versus clipping. Clipping is better, okay. Small anterior circulation, selection bias. Ruptured aneurysm treatment, okay. Dome neck ratio, posterior circulation. MCA wide neck, okay.
Okay.
God. Clipping versus coiling. Joint decision by surgeon. What's an IR? I don't know. Clipping. Good clinical outcome. Favorable dome neck ratio. One-off procedure. Difficult surgical approach. Expertise. Long-term outcome of foiling not known. Duration residual aneurysm. This scenario. BP 180. Fuck me. Spasticity with Botox. Fibromuscular dysplasia. Positioning, craniotomy, brain relaxation by releasing CSF. Palate clip dome dissection. Upper closure. Okay, ptosis for 10 days. Right eye adduction. Upward gaze. Dilated sluggish. Complete ptosis. Nerve 3 palsy. Was it like that? There's a little thing here. What's that? Ptosis. Some onset of headache. Okay, neck rigidity. Cái啲血瘤嗰啲咩爆血管嗰啲嘢嚟嘅。Healing. Okay. Discharging day 15. Toilet going general anesthesia. General, okay. Femoral puncture. Okay. Guiding catheter. First coil. Heparin. For follow-up DSA, okay. Clipping, complete obliteration rate. Long-term results. Surgical risk. Minimally invasive. Dual anti-platelet therapy. Serial angiograms. DSA at month 6, okay. Putamen, Thalamus pons, Stitch. Okay. Early surgery, medical. Early surgery, no benefit. Okay. Some onset of right side weakness. Okay. BP 240. What? Right dense hemigrade 0. What? For a drop of GCS after CT brain with DSAT. Okay. Intubated in emergency department, proceed to EOT. For clot evacuation. It's like a stroke. Progress post-op. E4V2M5. Okay. Sitting with 2 moderate assistants. Failed MMSC. Of course, you can't sit. RT feeding. Nozac. How old? 39. Poor woman. Terminal. Hydrocephalus. Is this the with the Grand Narukami Shrine? Murmuring Creek. Cuniotomy. Okay. Thalamic. Okay. EBD. Cerebellar. Low threshold due to brainstem compression. Okay, AVM treatment goals. Embolization, stereostatic radiosurgery, complete obliteration surgery. 24. Sudden onset of headache. Okay. E1, V1, M5. What? Hydrocephalus gradually recovered. Oh my god, that's a bundled up of, you know, stuff. Okay, one day before SRS. Collapse, okay? Left hemi. Lordy. Excision of AVM. Post-op. Okay. Walks with supervision. Rehab, okay. Novo 7. Moment. Unblinding. Decompressive craniectomy versus conservative. Primary outcome, blah blah. 50%! Okay, so craniectomy is better. Reduce mortality but increase disability. Of course, because, you know, the person is saved. Failed to demonstrate superiority. Some onset left-sided weakness. Decrease. GCS. 3, 4, 5. Oh god, look at that. Duroplasty. Complicated with left DVT. Uh-oh. Thrombocytosis. Battle index 34. Quadrupod needs to mod A. Prevention is better. Of course, no shit, sir. Secondary prevention. Large vessels. Okay. Small vessel bypass and stenting. Fibrillation, hypercoagulable state. Atherosclerotic vasculopathies. TIA. NPC with RT. What? Cancer. Stenting. Okay. ECIC. No TIA slurring improved. Okay, that's that. Maybe I should stop. Okay, I should stop and rest because there's only 2 more slides left, and you know I can, you know, go rest a bit.